Today at Quanta Laser Labs, we're going to talk about some of the non-ablative wavelengths for fine lines and wrinkles. I affectionately refer to these as the teens. They are all the wavelengths that really fall in between 1320 and 1927. So there is 1320, 1410, 1440, 1450, 1540, 1550, 1927. All these wavelengths have a very, very similar absorption characteristic. They're very highly absorbed in water, but they're not an ablative technology like a CO2 or an erbium. Now, these devices were the first ones to really come to market with a fractional technology, and that was why they really had a lot of popularity in the 2007, 2008, that sort of time frame. However, once companies realized that you could fractionalize a CO2 or an erbium, some of these, the teens lost a little bit of their allure. There is absolutely a place for them in the marketplace. You typically do not have as much downtime with these sort of wavelengths as you do with a CO2 or an erbium, but you do have to have multiple treatments. What you might get in 1 or 2 treatments with a CO2 or an erbium, you might take 5 or 6 treatments with a non-ablative wavelength. And so while these are absolutely can be a great tool for your aesthetic practice, make sure that you understand the limitations and the additional treatments you're going to have to use with these non-ablative wavelengths to get the same sort of effect as an ablative wavelength. Call one of our aesthetic laser consultants today and we can help you navigate this very complicated field of skin rejuvenation lasers.